Effects of Hysterectomy on PCOS Symptoms, by www.hysterectomy911.com. Are you experiencing PCOS symptoms and are considering undergoing a hysterectomy to treat them? Well, you might want to think twice. The effects of hysterectomy on PCOS symptoms may not always turn out the way you want them to. PCOS polycystic ovarian syndrome is a condition where the ovaries are enlarged and contain a number of small and painless cysts. This can bring on the notion that because the ovaries are the problem, then their removal through a hysterectomy would treat the condition. PCOS is really a hormonal disorder, however. Therefore, a hysterectomy's effects on PCOS symptoms will not necessarily include their cure. Hysterectomy as a treatment for PCOS is usually performed as a last resort. PCOS is characterized by the following symptoms: lipid abnormalities, obesity, acne, male pattern hair thinning, excessive hair growth on the body or face, absent or irregular menstruation, and infertility. Rather than minimize these symptoms, though, hysterectomy effects on PCOS symptoms might even include risks because of diabetes, heart disease, or obesity. Aside from the onset of menopause, some of the risks are the necessity for changing the abdominal incision during a hysterectomy, problems from the anesthesia, injury to the bladder and bowel, and excessive blood loss, among others. Leaving PCOS untreated is risky. It can lead to problems with the endometrium such as endometrial hyperplasia, increased chances of miscarriage, infertility, and endometrial dysfunction. At worst, PCOS symptoms that are left untreated can lead to endometrial cancer or the removal of the uterus and the ovaries. When this happens, hysterectomy effects on PCOS symptoms may prove to be curative. Hysterectomy is a surgical procedure where the uterus, cervix, fallopian tubes, and ovaries, or a combination of these, are removed. It has permanent consequences such as the onset of menopause for women not yet in the menopausal stage and the inability to bear children. Then there are the hysterectomy effects on PCOS symptoms that are common among surgical procedures, which include risks and the development of complications. Instead of relying on the effects of hysterectomy on PCOS symptoms, it would be best to discuss other options with your doctor. Hormonal treatments have better chances of lowering the risks posed by PCOS symptoms. Other treatments that may prove more viable include fertility therapy, oral contraceptives, and weight loss for the obese. Even better, PCOS symptoms and the risks they cause may be reduced by managing your hormonal balance. You can do this by maintaining a healthy diet, exercising, managing stress, and taking nutritional supplements. For more information on hysterectomy and related topics, go to www.hysterectomy911.com. Copyright 2009, all rights reserved.